You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J Tassoni Jr., with today's guest.
Welcome to Recovery TV. I'm your host, John Tassoni. This is the voice of hope. My guest today is Mr. Patrick Tighe, and Mr. Tighe is the Health Insurance Commissioner of Rhode Island. Thank you, Patrick, and thank you for joining us today.
Thanks, John, so much for having me. I really appreciate it. It's great to be here.
So a lot of people don't know what you do. So can you explain to the folks that are watching this program today what the Healthcare Commissioner does?
Sure. At the Office of the Health Insurance Commissioner here in Rhode Island, we really have four major purposes. The first is that we work to protect consumers of health insurance. The second is that we work to ensure the fair treatment of providers, doctors, hospitals, others in the healthcare and mental health system. The third is that we have a responsibility to improve the healthcare system as a whole. So that means trying to make the healthcare system more affordable, more accessible, and higher quality for everyone who's availing themselves of services. And then finally, we have responsibility to guard the solvency of commercial health insurers. And so that means that we're trying to make sure that insurers conduct their business in a way that makes sure that their financial houses are in order so they can keep financing care here in the state.
So when an insurance company files for rate increases, that's automatic, right? You just give it to them.
So actually, no. Here in Rhode Island, we have a very robust what's called rate review process. So when those insurers file what they propose to charge for health insurance premiums, our office has to apply a high level of scrutiny to those, and we actually have to approve any of those increases before they can begin charging. And the way we decide what to approve and what not to approve is really we hold it up to two criteria. First, is it affordable? And secondly, is it actuarially sound? And so what that means in kind of layman's terms is, are the expenses that they propose to charge for their premiums, will those cover their costs? And so we try to make sure that we balance those two considerations.
Mm-hmm. Staffing, your office.
Mm-hmm.
One person, two people?
Yeah, that's a great question. So we are actually a very, very small office. We're among one of the most lean offices in state government, but we are able to carry out our duties effectively despite that. So we have I'd say about 10 people on staff in total, and that's responsible for regulating the entire commercial health insurance system here in the state of Rhode Island.
So I'm going to make a statement, and you don't have to agree with it, but it's disturbing to me as someone who was in the legislature when you have such an important role in today's society of healthcare, parity, and a number of other things, that you have the most lean organization in the state. That shouldn't be. Anytime that you ask for staff to do reviews, to do investigations, it only makes sense to me, being on the other side of the fence now, that you be given what you asked for. And I see these other departments willy-nilly. And you're probably one of the most important departments in the state.
Well, so John, first of all, thank you for saying that. We obviously at OHIC, we try to be very respectful of the fact that we have to be stewards of tax dollars and we have to be as efficient as we can. But certainly, any resources we are given, we work to apply those to hold health insurers accountable, to ensure that consumers get what they deserve out of the healthcare system. So certainly, any investments in the office, we work extremely hard every day to make sure that we put those to the best possible use.
Here at the Leadership Council, we work closely with your office, and I have to tell you, and I'm surprised of the leadership over there and the responsiveness at your office when we have a problem, and that really I'm hoping that people watch this show and say, hey, legislators, we need to give them more help, because when we have issues, they're not small issues with our organizations, because everyone is striving to be the best that they can be with just little or no increases, and we're starving. Our organizations are starving. So if anyone is watching out there who's a legislature, you need to get to Patrick and see what they need so their office can operate in an efficient manner, except, running around with like chickens with your head cut off because you don't have the staffing you need. I know you can't say nothing, but that's why I'm saying it, because I'm dealing with it on a weekly, monthly basis with our providers that need help. So I want to talk about another thing with you, parity. Parity has been at the forefront over the past couple of years. Our organizations don't believe that we're getting the parity that we need. So tell me what your office is doing.
Yeah. So OHIC, a couple of years ago in 2018, OHIC was given specific duties by the General Assembly, by the legislature, specifically in regards to your point, John, mental health and substance use disorder parity, as well as maximizing access for mental health and substance use disorder services. So we have a specific charge to work to hold insurers accountable, to have things be covered at parity. And so what that means, as I know you appreciate, but potentially some of your viewers I know may not, but that essentially mental health services and substance use disorder services, they have to be covered in the same way and to the same extent as equivalent physical health care services, because that's the law, because that's fair, and because that's what people need to be able to thrive. And so our office has a responsibility to ensure that that's actually happening. And so to your point, in order to do that, we need to be able to conduct really robust investigations. Those are called market conduct examinations, where we go into over a period, over many, many months, and in some cases years, where we'll investigate a particular health insurer or all of them and make sure that they are actually following those rules that require that particular coverage. I'll also note something you alluded to earlier that helps us not only become aware of issues if they're happening so we can launch future investigations, but also help people resolve issues if they think coverage is not being covered at parity. And that's that we actually directly help respond to and resolve both consumer and provider complaints. So if anyone's having an issue with any of their coverage, but in particular with their mental health coverage or substance use disorder coverage with their insurer, they can come to our office and we will directly help them resolve those issues and investigate it. And we also work with a really great partner in the community, the Rhode Island Parent Information Network, who helps, again, all the way from end to end, from investigating the issue to potentially filing appeals, or if it's appropriate for us to take compliance action. So that is a huge part of our work, and we have a specific charge, and so we prioritize work in the behavioral health area as a result.
I know we talked a few months ago about doing something on your website, filling out a form, a complaint form. Is that going forward? Do you have that now?
So it is going forward. We were really fortunate. We received funding from the federal government for a grant, and we're devoting a specific portion of that grant to not just having out a fillable form, but to really make our whole consumer-facing part of our website as accessible and easy as possible, so that people don't have to go through a complicated process to file a complaint. Certainly now you can call us or you can call the Rhode Island Parent Information Network, but we want to make it really easy for people to log on and do that, and that way we can track and resolve things even more effectively. So that will be going forward. We're working in the design phase right now, but we're going to be rolling that out, again, using federal resources that we've been able to access.
So, Commissioner, what is your website?
Yep, it is www.ohic.ri.gov, G-O-V.
That's great. So I know that's going to be one of the things that we work on in the future.
Absolutely.
Because it's very difficult for people, elderly, to come down to your office, to sit down, file a complaint where they can just do it on the computer, send it over. Your staff takes it, runs with it, and does what they need to do with it. How many investigators do you have on staff?
So currently, folks that are involved in those investigations, we have no dedicated investigators, meaning no one who that's their sole function. We have about, including the supervisor, we have about 4 people who are, in addition to their other range of duties, who participate in investigations.
I want to talk a little bit more about that when we come back. You're listening to Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope, and we'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
With these,
and this,
with my mouth shut,
and my ears wide open,
it means that from the moment you walk into the room,
you're the most important patient to me.
Welcome back to Recovery TV. I'm your host, John Tassoni. Patrick Tighe is in the house today, and Patrick is the Healthcare Insurance Commissioner for the state of Rhode Island. Welcome, Patrick, and thank you for joining us today.
Thanks again, John. It's great to be here.
I want to talk a little bit more about a topic that seems to be discussed on a weekly and daily basis is child health care. With the pandemic, with the kids not going to school, which a lot of the children now we're seeing effects of the pandemic. And there's been a lot of talk about the new vaccine that's coming out for children. Tell me about what your office is doing for child health care issues.
Sure. Thank you for asking that, John. I mean, I think first of all, I think it's really clear to all of us in the community, we are in the midst of really a crisis with children's mental health care. And it's something I know in many corners of state government that we're working to address with our partners in the community like yourself, John, and others. So I think it's critically important. And certainly the pandemic exacerbated that, made that even more clear to all of us, but it's something that certainly predates the pandemic and I think will persist beyond it. And so we have to address it and continue to prioritize it. So what we're doing at OHIC for our part is we're looking at a number of different avenues that we can do to address children's behavioral health. Specifically, the thing that currently we are focused on is looking at network adequacy. And so what that means is when you call your insurance company and you say you want to avail yourselves of behavioral health services for your child, can you get access to the type of clinician that you need to get the support that your particular child needs? And so we're looking at, can we establish specific standards for commercial health insurers that they have to follow that can give consumers greater assurance that when they actually call and they need to get an appointment, that they can do so in a timely way. You know, I can tell you, John, I have a young daughter. I'm particularly sensitive to this. Our family has certainly at times needed to seek mental health treatment and support, and it can be really, really hard. And I'm a parent, right, who I work in the system. I'm the health insurance commissioner. Mm-hmm. And even for me, it can be challenging to get access from my family to the services that we need. And so this is something for me it's both professional, but it's also personal. Mm-hmm. And so I want to work really hard, and that's what we're doing with these new development of these new standards, to be able to look at how can we ensure that coverage actually means you can access the treatment that your family and children need.
Mm-hmm. You know, one of the things that we talk about here all the time is too about psychiatry. And we don't have enough psychiatrists in Rhode Island. Do you see that getting any better? Do you see when you're discussions with the healthcare providers? I mean, are they willing to up the funding so these guys can get paid a little bit more money? A lot of them have moved across to Massachusetts.
Yeah, so it's absolutely something, you're absolutely right. I hear it most frequently probably is the difficulty in finding and having adequate access to child psychiatry. We hear that all the time. It's certainly not the only area, but it is a major one, and we hear about it, and I hear about it constantly. And so certainly I think some of these standards that we're talking about can absolutely assist with that, but definitely the issue of having enough providers of that kind, it's a more fundamental issue with that. And so I think in the short term, it's going to be challenging, but to me, I think we have to think about all the levers to bring to bear on that. And you're right. Part of that absolutely is looking at reimbursement levels and while our office doesn't directly set provider reimbursement levels, one thing that we are looking at that I know you and I have discussed in the past is developing what's known as a behavioral health spending standard. And so right now we're going through an analysis to look at specifically be able to quantify where are the areas of our mental health and substance use disorder care system that have not been invested in appropriately over the years, and how can we direct insurers toward making targeted investments to increase reimbursement and then hopefully have more providers supplied that can serve people and families.
Right, and the other thing too, as I look at it, if we don't fix this system, like right now, you hear people saying 10, 12 hours in a waiting room, in the emergency room. Now, but this system is not fixed. Going forward, you're probably looking at a long period of time waiting in the emergency room, because if you can't get access to healthcare, where do you go? You go to the emergency room. Where is the quagmire? In the emergency room. Who ever heard of the Rhode Island Hospital closing one of their units because they don't have enough staff? As the number one type organization in Rhode Island, they're the only ones. And you close a wing, and I've heard horror stories about the length of time you have to wait in there. So if we don't fix the back end, the front end is going to fail badly. Your thoughts?
Yeah, absolutely. I think to me, even though OHIC is responsible for regulating the insurance system, the reason we do that is so we can have a healthcare delivery system that is effective, high quality, and ultimately, as you're saying, accessible. And you're absolutely right. When you have a situation where there isn't access to the right care at the right time in the right place, then it's not as if those outcomes just simply nothing happens. What happens is people have poor outcomes, which is the most important thing to address, but also we end up spending a lot more in the system, and that puts further strain on the system. And so we need to address those things upstream. And to me, that really goes to, we have to look at the parts of our healthcare system where there has been systemic underinvestment, and we have to look at making investments there, because we know that that's going to serve people better, and it's going to pay dividends down the line. And look at other parts of the system where potentially that there's been overinvestment. So there really needs to be a thoughtful approach to saying, how do we ensure that the resources are to the providers that need it, and so that consumers can access those lower intensity outpatient services, for instance, and community-based services, so that you don't, to your point, have additional ER visits and things, because that's not the experience a person should have, and it's not necessary. So we have to absolutely, but you're right, that all comes about how are we supporting those community-based services and less intensive services, and that's where I think we need to focus our attention.
Yeah, you look at the underserved and people who have problems getting health care. Where do they go? They go to the emergency room. Where do they plug up? The emergency room. Some of them use the urgent cares, but it seems to me that everyone that I've talked to, the uncompensated care, even though people have the accessibility to get on Obamacare, sometimes they can't even afford that. And the deductibles are so high that they say, well, you know what, I might as well just take my chances. I'm not going to take my medication. And if I get sick, I go to the emergency room. Something's wrong. Something is wrong with the system.
Right, absolutely. And another area where I think we need to reform the system, and again, support consumers, support providers in having the system that they deserve and need. It's really about the integration of primary care and behavioral health, and that's been a huge priority for the office, and it's going to continue to be, because again, how can we support the transformation of practices, creating linkages between the mental health care system and the primary care system? And certainly in Rhode Island, we have made inroads there, but there's a lot more work to be done, because again, we can serve people better. And of course, we know people don't, even though we oftentimes treat these as separate systems, they're not. People are integrated people. Their mental health and their physical health go together. Their outcomes track together. And so figuring out how we do that, and we have a number of initiatives that are going to stay focused on that, because it really is an important part of getting to the health outcomes that people need.
Great. This is the guy right here. You're listening to Recovery TV. I'm your host, John Tassoni, the voice of hope, right here to my right. We'll be right back after this.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You know, you can make it through this, you can get back on track.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
Addiction Recovery Institute with locations in Pawtucket and Warwick have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Welcome back to Recovery TV. I'm your host, John Tassoni. Mr. Patrick Tighe is in the house, and Patrick is the Healthcare Commissioner for the state of Rhode Island. Patrick, thank you for taking time out of your busy schedule to join us today. It's always a pleasure to see you and have a conversation with the issues at hand. I want to talk a little bit about a thought. Since we, as a state, we're so small, not many MCOs in the state. I think there's 4, maybe 5. Is there any thought of having like a summit with them to sit down and quantify what we really need to fix and how we go about having a road map of how we need to get there? Has there ever been any thought about that?
Yep, so certainly. So I think to your point, John, about the scale of Rhode Island, one of the biggest ways I think we have an advantage here in the state is actually our scale, because we're able to get everyone in a room and have that kind of a conversation. And over the years, as I've done work here in the healthcare system and in government, I've seen a lot of progress being made because of that. So to your actual question, I'm very open to that, and because I've seen that work of getting all the right people around the table, whether or not you're talking about payers or providers or consumer advocates, government. We can have these collective tables where we can have an open conversation, diagnose the issues, and come up with plans to collectively address them. So on this front, we have a range of meetings that we could leverage for this, and I'm very, very open to it, to working with you and others to think about what could actually make sense there. Because I think again, you're right, we have many issues on the table that could benefit from that.
Right. In 2004, we had a huge problem in Rhode Island with affordable housing, which I was the chair of the committee. And we did that. We put everybody in the room, we locked the door, said nobody can leave until we get it done. We got it done. I mean, obviously now there's a ton of money coming into the state for housing. Get it done. Get it done. It's not hard. But Patrick, I want you to tell my listeners again your website, your phone number, because we only have a few minutes left.
Sure, certainly. So I think the best way to reach us is to go directly on our website, which again is www.ohic.ri.gov. On that website, you'll see the different phone numbers that you can use to access the different parts of the office. But certainly, John, anyone can always reach out to us, and we'll make sure that we get them to the right place so they can get the support they need from either us or from one of our community partners.
Yeah, and I want to tell my whoever's watching, whoever's listening, don't sit back. If you have an issue with parity, if you have an issue with your insurance, if you have an issue with people not being covered for the amount of monies or the issues that you have at hand, call his office. They will help. So you've been listening to Recovery TV. I'm your host, John Tassoni. We'll see you next week.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
When people find out that I've been sober for a while, they say, oh, you must have great willpower. The truth is I have no willpower. And that's why I decided to get help. It must take a lot of strength to stay sober. No, it takes strength to ask for help. And once you're done, once you've decided that you don't want to live like this anymore, the real strength and the real courage comes when you ask for help. And then you'll find that people are willing to give that help. And that's when your life can really begin.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.
Sunday mornings, join host John J Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.